Hello, everyone, and welcome to the first edition of the Diabetes Care Summit. I'm Dr. Barbara Akimbua, and I'm your health buddy. This summit is for you if you've been diabetic for a while and you've been struggling with keeping your blood sugar controlled, either because you have problems knowing what to eat, when to eat, how to eat, what else you need to do to keep healthy, or you do know these things, but it's difficult to be motivated. It's also for you if you have an elderly parent who is diabetic that you care for and you find juggling medications, clinic visits, meals, and then illnesses in between overwhelming. Or you're a beautiful married woman and all you would love to have is a normal pregnancy and delivery. And instead, you keep having miscarriages and stillbirths as a result of complications of diabetes. Or it could be your husband. He is the one who's diabetic. And during sex, you have problems. It's either most of the time he can't get it up, or he has other problems while you're having action. It's also for you if you're a health enthusiast and you believe that prevention is cheaper and better than cure. And so you would like to learn anything you need to know to stay healthy. During this summit, you listen to loads of interviews by different specialists, including myself. Some of the interviews are short and some are not so short. But I'd encourage you to watch each video till the end because there's loads of important health information and you're getting it all for free. So, once again, welcome to the Diabetes Care Summit. And don't forget, I'm Dr. Barbara Akimbua and I'm your health buddy. See you on the healthy side. I'm going to be discussing with a colleague of mine about what happens to the kidneys in diabetes and what we can do to prevent this problem. So I would like him to introduce himself and tell us what he does.
Okay, hello everyone. It's my pleasure to be on this program. Thank you, Barbara, my classmate, for inviting me. So my name is Dr. Esla Abene. I work with Jos University Teaching Hospital. I'm a nephrologist, means I manage patients with kidney diseases. Thank you.
So thank you for explaining what a nephrologist is. I would have asked you that next. So what are the kidneys and what function do they perform in the body?
Okay, so the kidneys are a pair of organs. Usually every individual should have two, but some are born with one and it's okay. But normally every individual should have two located somewhere in the abdomen at the backside. So they basically perform maybe three main functions. There are excretory functions. Excretory, I mean, what I say excretory, I mean removal of waste products. So it filters the blood. So the blood that has dirty things.
So
After,
it removes waste products from the blood.
Yeah, it removes waste products from the blood. So that's the main excretory function.
And
then,
how does it, when it removes them from the blood, how does it take them out of the body?
Okay, so it forms urine. So once you're passing out urine, you know that yes, the kidneys are working and removing waste products. So the filtration of the blood comes out as urine. No, another important function is trying to make the environment of the body suitable for normal functioning. That's what we call the acid-base balance, so that the body is not too acidic, it's not too basic or alkaline. So a normal environment for the cells, tissues, and organs to just work. That's another very important function of that kidney.
Okay, so I want to ask a question now that you've mentioned that, because there are many instances where people say they are drinking teas or drinks or things to either acidify or remove the acid or whatever. So the kidney is the organ that performs that function. You don't need to drink anything or take anything to do that.
Absolutely. Once your kidneys are fine, if the body is too acid, it will remove the excess acid. If it's too alkaline, that's the other extreme side, it will bring it back to normal. So another important function is making sure the blood pressure of the body, it's okay. It regulates the blood pressure, and sometimes it does that by, well, your blood pressure is getting too high. Sometimes it just excretes. It will allow you to remove salt, because salt, once it accumulates in the body, it makes the blood pressure go up. The same thing too, it retains salt to
To
bring the
increase
blood
the
pressure
blood
up.
pressure. Okay.
Yes. So
So
just a very close one to that, because it's salt and water retention, they work together. So if your body is too dehydrated, for instance, in Makodi or very hot environments, the kidneys will make sure your body conserves water, you know. So
so you urinate less.
urinate less. Now, if there's so much water in the body, like when it's very cold, like the weather around the plateau, you discover that the patient will be, or an individual will be urinating a lot. So that's one of the things, how the kidney does that, to make sure that the water level is just adequate in the body. Now we have another very important function of the kidneys, the hormonal functions. Now, hormones are produced for normal functions of some organs or some systems in the body. Now, two important hormones are produced by the kidneys. One, we call it erythropoietin, and the second one, we call it active vitamin D. Now, erythropoietin helps in the production of blood. So
Okay.
once you are having problems with your kidneys, erythropoietin will not be produced, and your blood level, the patient's blood level, will continue to drop, sometimes requiring blood transfusion again and again. Vitamin D generally ensures that we have strong bones. That's just one part of it, but there are other functions of vitamin D. So by and large, these are some basic functions of the kidneys.
You've mentioned more than three. You've mentioned about five. I'll just go over them quickly. So
Yeah, I tried to categorize them into
yeah.
three groups.
So
Okay.
the first one is that it excretes waste products through urine.
Yes.
The second one is that it maintains the internal, the way the body is on the inside, so that it can function properly. So it's not too acidic, it's not too basic. It is just normal for the body to function properly.
Right.
And then it maintains normal blood pressure. And then a hormonal aspect has two functions. One, it produces a hormone that produces blood,
Yes.
and then it produces another. So please remind me the fifth one, the second hormone,
Vitamin D,
vitamin D
erythropoietin, and vitamin
and
D.
vitamin D.
Yeah.
So those are the five functions. So you mentioned most people have two kidneys,
Yes.
but a few people have one. If someone has one kidney, can it perform all these functions adequately? No problem.
Yeah, one of my professors in the university told me maybe the reason why God gave us two is so that we can give out one, and to help. And that's why you keep hearing kidney transplant, and it's all about somebody donating one, and you can live well with one kidney. All the functions will be performed by one kidney. So these patients that are born with one don't even know. Sometimes when they go for some routine check after 20, 30, 40 years, then they discover, where's the other kidney? Is nowhere to be found, but they've been living their lives normally without any problem. So you can live one well with one.
So I believe God is very generous. He knows how important the kidney. So he just gave us one extra.
Yeah. Yes.
Hi, have you heard of Soyo, the new diabetes care app? Studies show that the best medicine to take for diabetes is to get education about it. Because if you understand how it affects your body, you'll know better what you need to do to fight it. It will also help you to take care of someone else with diabetes. With the app, you don't just get education, you also get to make your management plan either for yourself or the person you're taking care of. There are also lots of other features like meal plans, medication, and other reminders to keep you on track. And if you fall off, don't worry, just get back on. This is how families can live healthy and happy with diabetes. Don't be left behind. Download the app at soyo.web.app to care for yourself or someone else with diabetes. So, if a patient has diabetes, how does this affect the kidneys?
Okay. So a number of things happen um, to someone with diabetes. Of course, we know that it's all about the sugar. Sugar control becomes difficult except one is aided with drugs, whether insulin or tablets, or some other lifestyle modification, which the family physicians are the best in giving that kind of advice. Now, but that poor control in the sugar usually triggers a number of reactions, let me put it that way, such that some chemicals, let me just put it that way, can get deposited in some parts of the kidneys, just because of that high sugar environment. Over time, they begin to cause changes in a particular part of the kidneys. And that part, we call it the glomerulus. The glomerulus has like a barrier. There's a filter, you know. So once the kidneys are working well, usually when we talk about filtering blood and producing urine, it goes through these barriers, the glomerular basement membrane. Now, there are changes that occur because of these high sugars, chemical changes, such that with time, this barrier begins to leak proteins. Usually, we shouldn't have proteins in the urine. The barriers, once they are working well, as the blood is filtered to produce urine to remove waste products, the proteins are taken back to the body because you need them. Now, but diabetes over time keeps causing these reactions or chemical changes to occur, such that with time, very early, an individual with diabetes, after maybe 5 years to 10 years, they begin to leak proteins, small, let me just use that word, little by little.
Little by little.
And usually it's not even easily detected, except is deliberately looked for in the hospital, because the usual test may not pick it until you go down to particularly look for that kind of proteins. Now, I'm emphasizing this because these proteins found in the urine or leaking through the kidneys are toxic. If you don't do anything about them, they will continue to cause more damage. In fact, with time, irreversible damage. So
Wow.
over time, they begin to leave scars, they call them fibrous tissues or scars like that in the kidneys, And once you have fibrous tissues or scars forming, you can't reverse that. So it now enters some form of progressive mode. It will move from one stage to the other with time, from leaking of small proteins, begin to leak larger proteins. The blood pressure begins to go up. The kidney function, all those functions I mentioned, will begin to get distorted. So with time, you
So
discover, yes.
so it's a problem that starts. It's like a pothole on the road. It's
Yes,
small
and in
and
fact, this
then
can take 15 years.
yes. So with
It
time, as the
just
road,
keeps
the pothole,
getting wider.
yes, and it gets until maybe it forms a gully, and
Yes,
it's easier to fix the pothole when it is small, when it is not.
exactly.
But the bigger it is and the more damage that has been done, the more difficult it is to repair.
Yes.
And then
Now,
when this happens in the kidneys, it affects all those functions you talked about, producing the hormones, erythropoietin, vitamin D, controlling blood pressure, maintaining the acid and base balance, and even
the water
producing urine.
balance.
Yes, the
Yes.
water and producing urine. I see.
Let me just add to that.
So,
There are a number of things that may make, because it's not everybody that has diabetes that will develop
kidney
kidney
disease.
problems.
Yeah.
No. So in fact, from my explanation, is the high, poorly controlled diabetes. Sugar level, when you come to the hospital, 15, 10. So very poor like that.
Okay.
So over time, that predisposes. Now, there are other diabetics that, let's say, they smoke, that increases the risk of that diabetes occurring. Then, particularly in Africa, they say the blacks, diabetic kidney disease, which is what we're discussing, is actually worse in Black people.
In Black people.
Yes, for some. If in the family there's a history of kidney disease, maybe the father has had, they told the father that maybe this present patient, the father has had problem with his kidneys, then this present patient is likely, or that has increased the risk of having kidney damage from diabetes. Some other things, like when the cholesterol level in the body is high, it increases the risk. When a patient is obese, it increases the risk. So generally, these are some things to also factor, because you may have one diabetic here whose sugar control is better than another one here. The one whose control is may not even develop kidney disease. But the one whose control is a bit better, because he has several other risk factors.
That is what make him get it.
Yes. So it's not just even the high level, the control of the sugar, but there are so many other things around it.
Okay.
So it's kind of complex when you begin to explain.
Yeah.
For some reason, you don't even understand why it will progress, but having the sugar well controlled helps a lot.
Okay, it's a good place to start.
Yes.
Okay, so what tests, you mentioned that you can't detect if the kidneys are affected unless you particularly check for it. What tests is used to check whether the kidneys are beginning to be affected by diabetes?
Okay, so it's a urine test. So as basic, we start from the urine. So the first thing is, a patient is coming for the first time with diabetes to the hospital. We may just do a simple urinalysis. If the urinalysis is negative, that's good. It means Yeah, it's not too bad. It's not too bad a place to start. But then it's good to now check for what we call microalbuminuria, because those are the ones that are not easily detected by conventional strips. But the good thing is now they are available in the hospital. You know, we go ahead and do a test to detect microalbuminuria. You know, those small proteins um, that continue to cause the damage before they become the big proteins, which you cannot reverse. Now, when an individual has microalbuminuria, either you do a urine albumin excretion ratio, that's one test, or you can have micral strips. Those are the kinds of those they are available in the hospital anyway.
But the one to do to check to find out
Yes,
whether there is damage that has started is the microalbuminuria test.
exactly, exactly.
We'll leave the other bigger tests to you. How to find out so that we don't get there.
Okay.
Okay. What can patients with diabetes do to protect their kidneys so that they don't get to this point?
Okay. The so at diagnosis, once a patient is told he or she has diabetes mellitus, first thing is not to deny or struggle with the fact that it can't be me. No, it's not my portion. Is to accept that you have a condition that cannot go. It cannot be cured. It's not like malaria that you take a few pills and it goes. But it's a condition that lives with you, but it can be well managed or controlled. You know, so accepting, I think it's a first place to start. Because from my own experience, when patients don't accept, you struggle over many things. Nothing just works. So I guess our audience, will have accepted that they have this. And because once you have accepted, the next step will be the counsel that the health team would provide. That will go a long way. And that counsel will come from the doctor, the endocrinologist, or the family physician that is managing. It will come from the dietitians or the nutritionist. It will come even from the nursing side. So like that, it's a team approach. They would advise on many things, to make sure that the sugar gets controlled, because it's not just about us giving out the pills. If these other areas are not well controlled, sometimes you discover that the pills will not control the blood sugar. So that's the next step. Now,
Sorry,
if
just before you continue. So I'm happy that you started with acceptance because it's like diabetes is a wake-up call. Something needs to change or some things need to change. And you we can't make those changes unless we accept that there is a need for change because
yes,
it practically affects your whole life. And maybe that is why lifestyle changes are so important. And so I just wanted to mention that before you go ahead.
yeah, thank you for that. Now, so after the acceptance, they've been counseled. Of course, for some, they will need to be on pills or injections, as the case may be. Now, patients must cooperate to take their pills or their injections.
Okay.
They mustn't get tired of it. You remember I said accepting that it's a lifelong thing that needs to be managed with drugs. During the counseling, the level of control would have been explained. And so initially, the drugs will be adjusted to get that level of control. a safe control that will not cause kidney damage. Remember from the beginning, I said it's when it's out of control that you now enter the road to
Yeah.
damage. So
Yeah.
we want
Yeah.
to avoid going that road, So cooperation by the patient, making sure they take their pills as and when due. Then coming back to see the doctors as scheduled. They don't get tired of that. That helps a lot. And then there are routine tests, which I even expect the patients to be involved. Because sometimes as health practitioners, we get carried away with the with the number of patients, with the load of work, and we forget. So a diabetic should know that sometimes once a year,
They should do their routine checks.
yes, and it's your responsibility to say, doctor, it looks like it's been more than a year. You've not requested my urine tests or some even blood tests or cholesterol tests. You remind the doctor
So
because
the
it's,
doctor should help you.
yes,
Okay.
yes. Sometimes we get carried away. So it must be some cooperation between the two. Unfortunately, I can tell you that there are patients who have been coming to us in the hospital 2, 3, 4 years. They come faithfully, but because they weren't told or they didn't know, or the doctors were not careful to check, basic tests like the urine tests
We're
were
not
not
done.
done. So they only come with their fasting blood sugar or HbA1c. Meanwhile, quiet damage has been going on for 2, 3 years. Which one
And
after when the test is done, you discover that what happened? But
before,
under our very noses, the damage happened. So basically, I would just say these are some things that the patient can help us to
help them.
help themselves and help even the physicians,
Okay.
by reminding the physicians to pick those early changes, which very early you can actually reverse it with treatment.
Okay. So when you were talking about high blood sugar levels causing kidney damage, you also mentioned that it's not that straightforward. There are other things involved. Things like if a father or a mother had kidney damage previously, if the
Yes.
person eats and things like that.
Mm.
So, what about drugs? Are there drugs that can affect the kidney, and then should diabetic patients avoid them?
Okay, yes, there are many drugs. There are many drugs that can cause kidney damage. And usually we try to counsel. Well, if such patients are coming to us, we will counsel them about drugs to avoid. One of it, which um, our viewers or listeners need to know, is over-the-counter pain meds. Ibuprofen, diclofenac. These are two common examples. Coincidentally, a number of diabetics may also have, I have arthritis, I have this. So they can quickly go to the pharmacy or send their children, please go and buy me that pain medicine that works for me very well. The way pain medications work, yes, they may kill your pain. They may kill the pain of the arthritis or so, but they will cause kidney damage, especially in a diabetic or hypertensive. They are more at risk, or elderly people. And sometimes this disease, you find it among old people. So that's one drug to be very, very afraid of. If
Okay.
you have pain, there are safer types of pain meds that will not cause kidney damage, which when you go to the hospital or the patient goes to the hospital, you'll be prescribed. Now, some antibiotics, when given in the hospital, can actually cause kidney damage. There are some In fact, the list is endless, but antibiotics,
Just the
painkillers,
common ones, the common ones.
common ones. Of course, there are, our people, the herbal medications work like magic for them. And sometimes in these herbs, you don't even know the concentrations of those agents. And a lot of these medications, they are either metabolized or excreted,
By the
either
kidney.
through the liver or a lot of it through the kidneys. So a diabetic has a condition that can damage the kidneys. Then you're taking other things
That
that will
can
be
damage.
filtered. You remember the kidneys filter. So they go and concentrate themselves and cause more damage. So by and large, I would say these are some things that we must avoid.
Okay, so
Yeah,
for diabetics, it's better for them to have their drugs prescribed by their doctor before.
exactly. Exactly. Yeah.
What about Panadol? Does that affect their kidneys as well?
Um, in very high doses for a long time, it can cause kidney damage. So when you
So,
have someone
okay,
abusing Panadol
okay,
in
okay.
very high doses every day, or for quite a number of the days in a week for a long time, that also can cause kidney damage. Yes.
So, are there foods that patients with diabetes and kidney disease should avoid? That's the first question. And then, are there foods that are good for diabetics with kidney disease? So it's the two extremes. What is there food that is good and is there food that is bad?
Okay. You know how the teaching in diabetes now is not as bad as they used to paint it in terms of diet. You know, so a number of diets are safe actually. Let me start with the safe one. You know, so the regular diet that they are counseled to eat will be okay for them. You know, however, when they begin to have kidney damage, depending on the severity of the damage, or depending on the severity of the kidney disease, because I told you it goes in stages.
Yeah.
Depending on what the tests are showing, we may counsel the patients to avoid or reduce certain foods or diets. Of course, salt will be one thing that we want to ask patients having kidney disease and diabetes to try to cut down, because kidney disease in diabetics, usually at some stage, they have hypertension with it. And their hypertension can be quite difficult to control. It's just part of the kidney disease in diabetics. So too much salt drives hypertension. So they will have to cut down on that. Secondly, when the potassium level is getting out of control, and particularly because one of the drugs we use to help prevent the progression of kidney damage in diabetics can raise the levels of the potassium. So instead of cutting down on our drug, which is helpful, we may ask them to look out for diets that are very rich in potassium and cut them down. That alone may just be okay, may suffice. So diets like plantain, bananas, all potassium rich foods like that, they may need to cut down or adjust the doses. That will help. Of course, I talked about other things like cholesterol. You know, it's a risk factor and it can accelerate kidney damage in diabetics. Of course, fatty rich diets, especially the fat from animals, they may want to cut down on those, things, red meats, so just animal-based fats generally. They may want to cut down on those. So So depending on what we see, we just try to control. Sometimes there's some restriction also in the total amount of protein, which the nutritionist will advise. Okay, for you, based on your kidney damage, this is the amount, okay, 1-2 pieces of meat for you is okay. Or fish or something is okay for you. Or some proteins from plants, this amount per day is okay for you. You shouldn't go beyond this amount. So if they keep to all that, I think they will do well.
All right. So when we have talked about what patients need to do to protect the kidneys, but when the kidneys are damaged, when there is now kidney problems or kidney disease, what can be done or what is usually done? What is the treatment? Is there a treatment? I know you mentioned transplants, but I think that is on one extreme. What other treatments apart from transplants are there?
Okay, so in between that, so I try to explain that kidney disease in diabetics, whether it's type 1, patients with type 1 diabetes, I believe, are listeners to this program or viewers. Patients with type 2, either way, it takes years and they move from one stage to the other. For type 1, you can actually predict that after 5 to 10 years, you are at this stage. Then after another 5 years, you move to this stage. Then you move to this stage, But for type 2 patients, which are the bulk of the patients, because of several other things that are around them, very comorbid conditions. They are obese, they have high blood pressure, they have high uric acid or gout, so all those things I'm mentioning are actually treatment points, at some stage that can help even reduce the progression before we talk about kidney transplant. So it's something that takes years, and a nephrologist can keep them very comfortably at a particular stage if they abide by all the things or instructions given.
So
So
the nephrologist will keep them at the early stage so that they don't get to the point
where they will require transplant or
yes,
dialysis,
or dialysis.
which I will mention. So so very early, we try to remember that those small proteins.
Microalbuminuria.
Yes. Once they are picked, there are drugs that are given. There's a blood pressure level that we don't want the patients to go beyond. So blood pressure shouldn't be more than 130/80 at every point or at any point. And we will try to use drugs like lisinopril, losartan, telmisartan, those kinds of things. I'm sure our listeners or viewers are familiar with those drugs. That's the reason why we're giving them very early. They can actually reverse that trend. But of course, some patients, we catch them when they have passed that reversible trend, So when they are leaking the bigger proteins, our target now is to even lower the blood pressure level. If it's possible, less than 130/80 at every point. So it could be 120/70, 125/75. That alone can help with these types of drugs I just mentioned, reduce the progression to the stage whereby they'll say, all we can do for you now is dialysis, or you have to go for kidney transplant. And of course, we encourage them to lose weight. If cholesterol is high, we try to control it by lifestyle changes and with drugs sometimes, um, those modalities. But by the time it gets to the last stage, when the patient is really very sick, remember all those functions we mentioned, the control, the body is not just responding well, the patient is very sick. Especially because of the excretory function. Those waste products have accumulated in the blood because of poor excretory function. The patient is sick.
They are no longer producing urine. They can't urinate anymore.
Because sometimes they are still urinating.
Okay.
Sometimes they will still be urinating, but they are just sick. blood level is going down, they are losing appetite. Sometimes they even feel like vomiting or they vomit, body starts swelling. And at that point, they may still be urinating. In fact, some significant amount of urine, actually, significant amount of urine, sometimes over 1 liter, 2 liters, but they are still not strong. So I can tell you that at the point when we're starting dialysis for some patients, urine output, total urine they produce in a day, up to 1.5 liters, but the waste product levels are very, very high. So at that point, the only thing that will help them will be, yes, we'll start removing the waste products, because kidney transplant is a process. They will be on dialysis, which is available in almost every part of the country, usually at least, or let me just say 3 times a week, until, kidney transplant is done.
Okay.
But we don't want to get there. But if we can catch them early and institute all these measures that we try to outline, they may not even get to that stage where they will require dialysis, or they are asked to go for kidney transplant.
Okay. So, what can patients with diabetes and kidney disease do to help the nephrologist give them the best care so that they don't get to dialysis or transplant level?
Okay. So by the time, from my experience, by the time this category of patients are brought to a nephrologist, usually they will be around stage 3.
So it's
A
already
lot
late,
of, a lot of them are already in stage 4.
which is late.
Yes. So so stage 3, 4, because stage 5 is the last stage where the patient requires dialysis or kidney transplant. So stage 3, stage 4, I have managed patients with stage 3 for 6 years now, and they are still in stage 3. So it's possible. And I mean, one of the patients is like 76 now, So, and we started right from when he was maybe like 17, when I came in to be part of the management. So you can see it's not like, okay, yeah, stage 4, the next few months you are moving there. But there are patients too that didn't do well. Blood pressure control became very difficult. One, because at that point, the nephrologist will prescribe sometimes 4, 5 drugs to control the blood pressure. And for the cooperative of the patient is needed, the patient and their relatives, to get those drugs and take them as prescribed. There's a target. But because getting 4 or 5 pills at the same time is quite an amount of money with the quality, the types of drugs we want to give. So cost is an issue. So compliance because of costs is an issue. So our patients have to help us here. I don't know how, but they have to pay out of pocket for some. If they have health insurance, that helps. But taking the drugs as prescribed and bringing the blood pressure down to target is the cornerstone of treatment at this stage when they are coming to me.
So
Sugar control may not be the main thing now, but the blood pressure control.
So you need them to cooperate with you by getting all the drugs they need.
Yes. 2,
by taking the drugs.
taking the drugs.
Okay.
Of course, we'll cut down salt in their diet.
Okay.
So they must cooperate. So the diabetic may just feel, this food doesn't taste well. It doesn't taste well. Just bring salt. Table salt, they just add it. Blood pressure keeps shooting up. Swelling doesn't go down. So those are things they can do from then they shouldn't just go and buy over-the-counter pain medications. At that point, anything you want to take, ask your nephrologist. Anything you must take at all. Relatives will come with many things, friends will come with many advice. At that point, you say, it's okay, I'm grateful. If it's possible, bring it to your nephrologist, because my patients do that. They'll say, doctor, I was asked to try this. It helped one patient. Will it help me? I'll just say, this one will not help you. This one, okay, say if you can take it. And those are things we do to keep them there, to protect, to prevent progression, further progression.
I'm happy you've mentioned that because in Africa, we are family oriented, we are communal. So illness is a family affair, is a family thing, and friends too chip in. They might mean well, they might
Yes,
not be trying to harm you. But the fact
exactly.
that you hear that something worked for A does not necessarily mean it will work for you. Because you may not even know if it's kidney disease that that person had. It could be something else that causes swelling of the body.
Exactly. Exactly.
It's good, it's important to personalize treatment because everybody is different. And like you mentioned, what works for A might not work for B. So with that in mind, what can family members do to help such patients? I've asked you what the patients can do to help. What can their family members do to help?
I think family members must always defer to the doctors. They mean well, but they must just submit to the doctor's counsel. You they must encourage their sick ones with diabetes and kidney disease. They must encourage them to go to the hospital. You know, they must support in raising funds. Some may need that support actually for the drugs. They must not bring their own drugs
Treatment.
outside outside what the nephrologist, the kidney specialist has prescribed to say, try this, try that. No, they must accept that they are not doctors. What looks like this one may not be the same as what is happening with their own relative. They mean well, but why don't they say, okay, let's all go to the hospital first. Let us hear also. At some point, the doctor will say, okay, then no problem, let's talk. And there will be some understanding and common ground and at the end. So, so family support, some of them will require family support in cooking, the kind of diet we want, family support in terms of finances, family support in terms of, in fact, psychological workup.
Encouragement.
Yes, to push on that, no, this is not bad at all. When they even get to the stage of dialysis, these patients sometimes get depressed, they give up. So a lot of support, love, attention is needed. Some have the money, but they have given up. And nothing just works, you just keep going down. If the mind is not just right, even the drugs may not work. So a lot of support, a lot of just being around them, is needed at this point. And please, they avoid what they heard outside and bringing it. No, they should come and take counsel. Let's agree together.
Okay, so what I hear you saying is that it's a team effort.
Yes.
It involves the family, it involves the patient, it involves the physician, it involves the different specialists or whoever
Yes.
is on the patient's team. And
Exactly.
top of everything that needs to be done is love. Because
Yeah.
you must love the patient, you must help the patients to love themselves, because that is sometimes what they need to be encouraged to keep keeping on.
Yes. Exactly.
So now to our final question. If there
Okay.
was one piece of advice you give anyone with diabetes or their family members, what would it be?
Well, firstly, I would just say diabetes is not a death sentence. Then, of course, kidney disease in someone with diabetes is also not a death sentence.
Thank you for that.
The two can be well managed, and cooperation from the beginning, you know, is needed. Once there's that cooperation, once there's acceptance of the condition, I think that's already a big step. I think I've mentioned that, but I just want to reiterate, you know, and of course, cooperation will now involve, okay, accepting what the nephrologist would say, what he will prescribe. And sometimes, yeah, coming along with family is important so that we're all on the same place. We're all on the same ground, to see how these patients get the best.
So thank you so very much, Tesla.
Mm.
Good to have classmates that can help out.
It's my
And
pleasure. Mm.
yeah, I'm really happy to have this discussion with you. I know it will be beneficial to everyone listening, whether they are diabetic or not, because the truth is we all know at least one person that has diabetes if we think about it. And so I hope we have all learned. I have learned some things too. I'm sure the listeners too have learned. And thank you once again. I'm glad you took my advice and watched the video till the end, and I hope you learned a thing or two. So don't forget, watch the next videos because there's still lots of information that will be really beneficial to you. Don't forget soil.web.app. Download it now. See you in the next video. Bye.